Dr. Aron McConnell. He's another video with us. He's back. So he's going to take, I'll be his patient or client. He's going to take me through a foam rolling sequence, basically from head to toe or from toe to head, whatever way you decide to go. And we'll go from there. We're going to get a lot of good information here. I'll have Aron take it away.
All right, good. So probably one of the most basic tools that you can have inside of your fitness and your health for movement is just a foam roller. Now, whether you want to get just like one of these, it's the basic black high-density foam roller, or they make white ones, they make non-porous ones. There was the rumble roller that has all sorts of knobs on it. It doesn't really matter exactly which one you have. This is a really good place to start. One of the big benefits that you can get from it is just kind of loosening up a lot of the soft tissue. And not only does that help with blood flow, but it also helps with kind of breaking down muscular restrictions, improving with lymphatic flow, and that helps to reduce any pockets of swelling, that sort of stuff. And just overall, you can feel a lot better with it, and it's also a good place to be able to warm up. It's not going to have the same sort of impact on stretching. So one of the things they've found is that research is that with stretching prior to exercise, when you're doing higher loads, so if you're doing max lifts or maxing out one day for a personal record, one of the things that's going to happen if you do a lot of stretching, you're going to have a negative impact on that. But the findings that they found with a couple of studies for foam rolling is that you don't have a negative impact on your strength, but you can improve your ability to kind of move. So it basically gives you your own little bit of a reset tool, kind of a self-massage to be able to loosen everything up. And this also works well if you're having like a lot of soreness the next day and that sort of stuff. You may not fully eliminate the soreness, but you'll probably feel a lot better and a lot less stiff the following day after a workout if you can do some foam rolling on a regular basis. So I usually try to start people as mainly on their kind of thoracic spines, one of the big places of stiffness that a lot of people have, and that's also where a lot of our movement is generated from, is that everything starts off the spine and moves outwardly from there. So if you start from the spine, you're in a good bet to kind of get a good sequence going on from there. So if I had Chris come on over and have him lay down on the foam roller, and you'll find everyone's got different tight spots, but basically one of the things you can start with is just rolling out the muscles on the spine. And so one of the things I tell a lot of people to do, you don't want your neck to be strained, so put your hands behind your head and pull your elbows in, and that pulls your shoulder blades out of the way. And then you just basically push through your feet, do a little bit of a bridge, and you can kind of roll up and down on a foam roller. You can roll all the way down. You're not going to hurt anything because this isn't narrow enough to put a lot of pressure that's going to possibly damage anything on your back. So you can roll most of the way down on your thoracic spine, almost even into your lower back, depending on your preference. What you want to watch for with this is kind of arching or getting a big rib flare. Now, Chris is kind of keeping his ribs down a little bit, but Chris, if you just like elevate your ribs so you'll get this like arch up here, then you're going to tense up the muscles and roll on them, and that doesn't really work well. One of the big things you have to focus on in foam rolling is kind of really being able to let your body relax into it, because otherwise you're going to end up just getting a massage on stiff muscle, and that doesn't work terribly well. So other things you can do around this, you can even turn a quarter one way or a quarter the other. You can roll a little bit onto the ribs when you're doing that rolling, so you got to get more to one muscle, more to the other. Also think about your lats, that they come all the way down and connect through here. You can still roll all that out along the side where your lats are. And we can kind of lead off from that, and Chris will roll right into it, letting this arm relax and drop down. You can roll up the side, right up on the side of the shoulder blade, and the lats are the muscles right down here that you can kind of roll onto, and you'll find different points, and you'll find a spot that's probably not so friendly. Chris found one. So as you find one of those spots, you can kind of roll back and forth on it, or you can just really try and relax into it. Now, the problem is relaxing into it kind of usually brings up the pain a little bit more, but again, you're not going to damage anything, so you're going to be able to kind of sit on that and let the arm relax. That's the hard part. Everyone wants to stiffen up their arm or their leg when they're rolling on it, and that's where you're going to kind of have a negative impact on how well that muscle is going to be able to relax. Sometimes you'll sit on it for 30 seconds. I've hung out on it for 2 to 3 minutes before to really shut down that muscle and to get it to loosen up, and that frees up a lot of the joints. So you can also roll a little bit more off the back of the shoulder blade and get a little bit with the rotator cuff, but that's a little bit better gotten with tennis ball or lacrosse ball. But that's probably where you go inside the arm, because the arm's a little bit hard to get to inside of foam rolling. So other things you can do on the mid-back, you can roll up just a little bit more on Chris. Now from here, you can kind of find maybe there's a tight spot where you feel a lot of muscle tightness or it feels really stiff. Again, bring the hands out of the way. You want to kind of tighten your abs a little bit so you're not going to be arching from the lower back. And instead, you're going to try and pin down the abs and hinge backwards. So So Chris is going to try and basically hinge from here, and then maybe even he can drop back or drop his hips down into it so he pushes on that mid-back so you get some extension through the thoracic spine. And the same thing can apply, just like when you were rolling from one side to the other, you can also roll, say, a quarter turn this way and then extend back and almost side bend into it. So you get a little bit more motion into side bending or even rotation. If you go one direction and rotate the opposite way, there's a lot of different ways you can play with this to kind of loosen it up. If you hear some pops or clicks, don't worry about it. Most likely it's just the joint separation that you're creating. Kind of like if a chiropractor or a PT cracks your back. It's sort of the same thing that you can sometimes get and feel when you're rolling out that. So, all right. So what we're going to do, move on to lower body. So easy one you can roll out right from that same position is right onto the glutes. All right. So you can just let the leg go out straight first, or drop out to the side. Either one. You can kind of quarter turn yourself, and you'll kind of feel, yeah, that'll work. And you can just kind of roll that out. Some people like the figure 4 position, so Chris brings this ankle up across, puts a little bit of stretch onto the hip muscles, and you can kind of find some tight spots inside of the glutes. All right, and that lets you loosen up more of that posterior chain, so if you're finding difficulty coming into a full hip flex position down into a squat or a deadlift, you might want to start loosening up the glutes. Also, then you can go down right from here. Chris brings his leg down, and you can go right into the hamstrings from there, and then roll out. So for this one, I actually like to have the roller a little bit more off to the side so that this leg is free and you don't have to worry about that. That also lets that foot roll in a little bit, so you're kind of more towards the medial hamstrings here, even sometimes into the adductors, or then you can go in the opposite direction and roll more towards the lateral. So if you turn the foot out, then you can get more towards the outer portions of the hamstring. If you don't feel like you've gotten enough weight into it, you can always stack one leg on top of the other so you get some extra weight on it. But again, you got to make sure that that leg is relaxed. And again, if you find points that are really painful, then you can kind of just hang out on them and wait for it to release. And that can be helpful for improving the mobility of the muscle. If we continue down the posterior chain of the leg, we can go right into the calf. Now, calf tends to have a lot of restrictions, mainly because a lot of times we're wearing heels, and so that puts us in that position of plantar flexion, which automatically kind of tightens up the gastroc and the soleus. And so Chris has already set himself up with the leg stack, and he can kind of roll out the soleus, roll out the gastroc, soleus being the lower muscle, gastroc being the higher muscle of the calf. And you'll find a lot of trigger points in these, and so you can kind of roll them back and forth by twisting the leg in and out the way that Chris is, or you can roll it up and down. You can even, again, just roll and just hang out on specific spots. And you'll find one side versus the other side might be more tender, and your legs may be asymmetrical, and that could be part of the problem. Maybe if you're squatting down and pitching to the side, it's because the ankle doesn't actually have enough sufficient mobility. So there's also a way to get this with a cross ball that I think we're going to do in a separate video. So going into the front of the body, big place that a lot of people tend to have a lot of tightness is right up into the quads, and particularly the hip flexor. You can get a little bit into TFL, which is a little bit on the front. And that's right in the front, so where you stick your hand through your pocket, that muscle's right there. And you can kind of, again, roll onto it, just in the same position. Chris has it all the way over, so it's out of the way of this leg, so that leg can support him, and he's on his forearms. Again, let the leg relax. This is the most classic one where people want to really tighten up that quad to try and brace against it so they can roll. The problem is, that bracing then stops you from being able to really get deep into the muscle where some of those deeper restrictions are. And you can kind of roll back and forth, roll in small sections over really tight areas or hang out on it. Chris is doing a modification where he's basically pinning down a portion of the muscle and then shortening and lengthening the muscle. And so that's flossing it around the restriction, which sometimes helps to loosen it up more when you're rolling on it. So and then the same thing, you can kind of roll up into the hip, even off a little bit to the side of the hip to loosen things up quite a bit around the front. We tend to be sitting down all the time, so we end up with this kind of forward tilt of the pelvis. We need to loosen up all those structures to let the hips come underneath of us in a neutral position. Probably the only other one in this position I'd say would be the adductors right on the inside of the thigh. And so that can easily be done just laying like this, let the leg come out to the side, and then you just roll all the way up. There tend to be tight points, particularly real down close to the knee. There's a good junction that I think Chris just found there that tends to have a lot of restriction, a lot of fascial tightness, because there's a crossover of multiple muscles there, and you can kind of roll that out. Again, you got to let it relax. If you don't have the hip mobility to bring the leg, say, all the way up, into a higher position because it'll put different muscles on different tensions when you bring it all the way up. You can always keep it a little bit lower. Your leg will be a little bit of a diagonal on the foam roller, and that can sometimes help if you don't have the hip mobility to come all the way up. But Chris is letting part of his weight rest in the legs, the rest of it's in his arm and his other leg, so that that leg can really relax down. If he tries to support himself entirely on that leg, the body's going to want to stiffen that up, and then kind of defeats the purpose of being able to massage out the muscle and let it relax. So, Chris, do you have anything else you want to toss in on that?
There's a ton of different ways to get the same thing out of this. And basically, Aaron talked about a bunch. I like to tell my patients and clients to just explore. You're looking for the spots that feel the most uncomfortable, they feel restricted. And then as far as the techniques, we talked about a bunch. We can make it active. We can have the hip go in and out. You can actually do a little bit of contract relax as well, where you actually just tighten everything up for a second. And then let it relax in, and you'll feel how it gets deeper. So you don't want to stay tight the whole time, because like Aaron said, then you're just you're wasting your time, you're working on a stiff muscle. But you can contract, tighten everything up, and then when you relax, you'll find yourself deeper into the muscle. But it really is an exploratory process when you're working on the whole body. You become your own self-assessor, pretty much, and you get really in tune with your body. So it's a great practice. It seems simple, but it really does a lot of good.
Great.
Anything else, Ed?
No, it's good.
All right, I think a lot of good information here, so take this for what it's worth, use it a lot, and I'll see you next time.